Starting this past Monday, indoor mask requirements have been eased here in Korea, some 27 months after their implementation to stem the spread of COVID-19. So what has been the public response? Are pundits predicting a tangible rise in consumer spending amid the eased mask mandate? And how does the latest shift into a new normal look to affect mask-making businesses? Welcome to Issues and Insiders. Today we address the eased indoor mask requirements here on the local front and the response to the measure, as well as their potential implications. Now for this, I have Kwon Soa here in the studio with me. So welcome.
Happy to be here, Sunny.
Right, so let's begin with details about the eased indoor mask requirements here in the country.
Right, so since the beginning of this week, so Monday, face masks are no longer mandatory at indoor settings. It's a recommendation. So this ease comes for the first time in some 27 months and has been decided by the government. Given the general situation of the COVID-19 situation, they say it has improved, and that's based on the number of daily infections as well as the number of patients that are in severe or critical condition, and also medical capacity and so forth. Now, the indoor mask rule was virtually perceived as the last remaining COVID measure following the lifting of outdoor mask mandates in September last year and the scrapping of social distancing measures in April. And that included restrictions on gatherings, business operation hours, closures of specific facilities, eating and drinking rules at numerous venues, etc. So since yesterday, Monday, wearing masks at schools and other education facilities, workplaces, supermarkets, department stores, gyms, and all kinds of public use facilities is no longer a must. So does that mean we can leave our masks at home or burn them all? Well, not exactly. As we're not completely free from COVID-19 infections yet, there are a few exceptions. On public transportation, at pharmacies and hospitals, as well as high-risk facilities such as nursing homes, you are still required to wear them. The gist is in the most confined spaces and in places that are home to or frequently visited by the most vulnerable. So, Sunny, here are a few details on the rules which are based on the confusion that people had or still have in certain places. So at stations like bus stations or subway stations, you do not have to wear the mask. But once you get on the transport, the public means of transport, yes, you have to wear the mask. And then, does a taxi belong to public transportation? Yes. So inside a cab, you also have to wear the mask. Now, also what's interesting is that school buses and academy buses also are kind of public transportation. So kids have to wear their masks inside the buses that take them to school, but once they're at school, they can take them off. And then also this one I found interesting, inside elevators. Would you have thought that you would have to wear the mask inside an elevator or not?
I would think you would have to because you're all confined.
Right, that's what I thought too, but it's actually just a recommendation. And gyms inside hospitals or other medical facilities, in that case, you have to wear the mask. So it's better safe than sorry, and to have your mask always with you because there are still a few exceptions.
Right, so, and all that being said, what has been the public response thus far to the eased mask mandate?
Well, for one, there was still some kind of confusion because of the issues that I just mentioned. But I was actually curious how the first day would turn out, but I was at home yesterday, so I heard from other people and I saw from media that for many people it didn't just come just like that, the change of the rule. And especially the morning and evening commutes looked similar to the past couple of years because many citizens, as I said, you have to have your mask on once you're on the bus or in the subway. That means they just keep their masks on while they wait for the bus or the subway at the station. And that's also why many people said they have been like kind of looking around what other people are doing, and many are still having their masks on. So that's one thing. And the same could also be applied to people at the gym or at dance classes. And again, at elevators, you could still see many people just wearing their face masks because because it just has become a habit for most of them. And also, while I believe most schools, starting from elementary school, had their kids maskless, but at kindergartens and daycare centers, you could still see some of them making their little children keep their masks on. And that has been welcomed by some and then not so much by others, because some parents welcomed that actually they could take off their mask from their little kids, because, you know, the so-called COVID era children who never got to see the faces of their teachers, their instructors, or
they started elementary school.
Exactly, elementary school or the daycare centers. So that's why some parents were very concerned about their speaking capabilities and their development. So many of them have welcomed that the masks have been scrapped at these places. So there's really different reasons for why some favor the change and some not. For instance, some office workers say that they had a lot of trouble with their skin because of the mask, so they feel better now, breathing better, let their skin breathe better. But then there's others who also mentioned that during the past years they never got a cold, and that's thanks to the mask, they say. So it's really up to the individual how they feel about this. But there's also been some figures coming out. According to a survey by the Korea Federation of Health and Safety, 6 out of 10 people actually thought it's not time yet to lift indoor mask mandates. 65.8% out of 1,001 people that have responded to the survey said it's a little too early. And then only 28.3% said, yes, it's time. And among those who said it's not time yet, 71.5% were seniors aged 60 and older. And those who were fine with the easing, 39.5% were between 18 and 29. So it looks like the senior population kind of felt it's a little too early, while the younger population wanted more freedom. So whether you welcome the move or not, I think for many, the habit of wearing masks has not just vanished with the change in the rule.
Right, I see. So I understand the response among small business owners, that is also quite mixed.
Right, because convenience coming from not wearing masks could mean more visitors, users, or more consumers for some businesses. But then taking them off also means higher risks of infections, which for some venues, again, can affect them in a negative way. Let's take indoor gyms, for instance. Some business owners of gyms say they welcome the move because many of their clients have been actually canceling their subscription for the gym because they didn't feel comfortable wearing the mask while they're doing exercises and it's hard to breathe, etc. But then there are also others that are fearing a spread of cases once everyone takes off their masks at the gym, and that again will be not really good for their business. And it's also difficult to tell the clients to keep their masks on, because some of them would say, well, the government says we don't have to wear them. And then some business owners of restaurants, for instance, also have mixed responses. Some say that they still want to recommend their their visitors to have their masks on before and after eating, for instance. But then others say, I mean, what's the point of letting them wear the mask if they just come into the restaurant or cafe with their masks on, and while they eat, they take it off, and then they have to put them on again just when they have to pay for whatever they bought. So yes, it looks like even business owners are still having those mixed responses.
Right, and the mixed responses, of course, come in light of the concerns of a potential rebound, that is. And speaking of that rebound, health authorities here, though, are downplaying the prospects of a resurgence in COVID-19, even in the presence of eased mask requirements, right, so?
Right, Sunny. As I mentioned briefly before, the general situation has improved, which officials also name as the reasons for why we do not expect a rebound following the easing of the indoor mask rules. Now, COVID-19 is currently being classified as a level 2 in the 4-tier infections control system. And according to experts, there's been a downward trend in cases lately, and the reproduction rate has been below 1 as of yesterday. yesterday it was at 0.77, and if the reproduction rate is below 1, it means we're not really seeing a surge, a spread in cases. If it's above 1, it's a negative sign. Also, the medical capacity has been stable, and that's also why the government has actually recently decided to reduce the number of hospital beds for those in critical or severe situation. And the number of imported cases, including the influx of infections from China, is at a manageable level, they say. Although right after the Lunar New Year holidays, people had expected for a slight surge in cases, and I think we are seeing a slight increase right after the Lunar New Year holidays, but that's also why officials had decided to make the change in the mask rules after the holidays. Now, health experts say, as was seen in the last few months, even though the mandate for masks outdoors had been lifted, a lot of people just kept on voluntarily wearing the face masks, and the same is now expected with the ease of the indoor mask rules. So they are not expecting a sudden uptick in cases because many people will voluntarily continue to wear their face masks. And this is why health experts say there should be a bigger focus on sustainable strategies while returning to our daily lives before the pandemic.
Right. Well, up next then, we take a look at the economic impact of the ease in indoor mask requirements here at the local front. And for this, I have Professor Kwon Soa at Ewha Women's University live on the line. Professor Kim, it's good to have you with us.
Thank you for having me, Sunny.
Right, Professor, large retailers, they're reportedly looking ahead at a jump in sales, especially of beauty products. Given the broader lifting of the mask mandate, could you tell us more?
Well, naturally, no face mask means people are more exposed to others' eyes. So we can expect that people will spend more money and time on their appearances. So one of the largest beneficiaries of lifting up mask mandate should be beauty products related businesses for both of producers and sellers. Also, no mask indoor indicates less social distancing. And then there would be additional impacts on other service industries beyond the beauty product industries. Industries like restaurant, department store, travel, and so on are in rising mood as of now.
Right, I see. And also sales of lipstick, I hear, actually, Professor Kim. And TV shopping channels also, they're also focusing on spring-summer fashion amid the absence of indoor mask regulations. Professor, how do you explain this connection?
With the face mask mandate finally ended yesterday, actually after 840 days, the TV shopping business is hopeful that fashion product sales will boom. Sales on online shopping channel and television-based home shopping are booming. For example, at Lotte owns online shopping for premium fashion products and cosmetic products revenue jumped 50% on year. In the period of early January. Along with TV shopping, department stores, fashion retailers are scrambling to host promotional campaigns to capitalize the newest government guidelines indoor masking rule ahead of Valentine's Day.
Right, I see. Professor Kim, generally speaking, do you expect a surge in domestic consumption? Well, consumer spending, that is. I ask because Korea's most latest quarterly findings for the last quarter of 2022 saw a contraction for the first time. That being said, quite a lot of pundits are saying revenge spending may be coming to an end here. What are your thoughts?
That is an important question, Sunny. Because one of the major reasons why Korean government relaxed mask mandate is reviving domestic consumption. From the end of last year, the total consumption is slightly declining, mainly due to less sales in clothes and shoes, which is related to warm weather. And in the same period, the rise of service industry like restaurants and hotels are limited because of high inflation and Itaewon accident. But no mask policy will marginally help to revive service industries as consumer sentiment recovers, along with the no mask policies.
Right, I see. Meanwhile, Professor Kim, some pundits say the eased in indoor mask mandate is looking to negatively affect mask-making businesses whose numbers amid the pandemic surged. Do you agree?
Well, as of now, it is difficult to forecast the demand for face mask with eased mask mandate. Of course, it is true that government's action to relax mask mandate provides a negative impact to the business. But according to a recent survey, more than 70% of Korean citizens still want to wear face masks inside and outside. So I can carefully expect that there won't be a huge drop in mask demand until the COVID-19 totally disappears.
Right. And moving forward, so while Korea eased its indoor mask mandate this past Monday, on the same day, Hong Kong reportedly eased its isolation for COVID-19 patients. Could you tell us a bit more about this?
So on the day we in Korea took off our masks, Hong Kong stopped issuing isolation orders for people who got infected with COVID-19. So people who tested for the virus, whether they used a rapid antigen test or a PCR test, they do not even have to, report that they actually got COVID-19. So basically, COVID-19 will be treated as an endemic, meaning it is up to the individual whether they call in sick to work or not. Local media cited health officials as saying those without symptoms can go out or to work. Those with symptoms should, however, rather stay at home and take a rest. And those that belong to high-risk groups should seek medical provision. According to authorities, Hong Kong has achieved strong immunity through vaccination and natural infections since early 2022, and cases in recent months were mainly mild or asymptomatic. Hong Kong had dropped social distancing measures late December, but what's left is the mask mandate. Masks are expected to stay throughout the winter, with authorities saying rules are likely to be eased in spring or summer. Now, one professor cited by the Global Times on condition of anonymity said that Hong Kong may gradually phase out its outdoor mask mandate in the middle of February when it gets warmer. Now, meanwhile, the mandatory isolation period for infected people is deemed as being the last provision that's remaining here in Korea. And different from Hong Kong, here in Korea, it's 7 days that we have to isolate.
Right, it is. And Professor Kim, speaking about Hong Kong, some economists believe mainland China's abrupt shift away from zero COVID will ultimately serve to boost the Korean economy once, of course, the two countries tackle their current travel restrictions. How do you respond?
One of the largest factors of declining Korean export for 4 straight months is shrinking Chinese economy. China is Korea's #1 trading partner, which covers a quarter of total Korean export. And Chinese economy has been suffered much from very strict COVID policy by Beijing. Recently, export to China decreased by over 20% on year. But as China reopens from COVID shutdown, Korean trade will likely pick up from a fully reopened Chinese economy. Therefore, China's reopening will be a significant positive for Korea, especially in chips export, which is #1 export item, and other electronic components export to China.
Right, hopefully. And staying in this region, so what are neighboring Japan's latest efforts aimed at embracing the new pandemic normal?
Well, before going into that, I just wanted to quickly mention that in Hong Kong, the isolation period is 5 days, and here in Korea, 7 days, because I remember I didn't mention that it's 5 days in Hong Kong.
Thank you for clarifying that.
Sure. So the Japanese government announced last Friday that it plans to treat COVID-19 in the same way it treats a common seasonal flu. On May 8th, Japan is expected to reclassify COVID-19 from its current level 2 to a level 5 disease. The second highest level 2 is on par with tuberculosis and SARS. Now, reports say Prime Minister Fumio Kishida instructed his cabinet for a gradual review of restrictions. So starting in spring, indoor face mask rules may be scrapped, just like in Korea. What else might become a measure of the past with the down leveling is the quarantine period for infected people. In terms of masks, though, Kishida reportedly said wearing face masks is to be left to the judgment of individuals. But as Japanese citizens are used to wearing face masks even prior to the pandemic, in Japan, this lifting is not expected to change the scene that drastically. And even already in uncrowded outdoor settings, it's allowed to take off their masks, but many Japanese citizens still prefer wearing the mask.
Right, I see. And finally, back on the local front, Professor Kim, given the current state of affairs, do you foresee perhaps the Bank of Korea maintaining its current rate hikes, or do you see a pause?
That is a tough question, Sunny, because there are quite a few uncertainties ahead in Korean economy. But if I give a best expectation rationally given current information, it is almost the end of base interest rate hiking cycle under positive growth, given China's reopening and also front-loading of fiscal spending. So Bank of Korea might go for one more 25 basis point hike before a pause for the rest of first quarter of this year, or January, February, March period.
Right, I see. All right, Professor Kim, as always, thank you very much for your thoughts today and your time.
Thank you very much.
Right, and back here in the studio, so thank you for your updates on the indoor mask mandate.
Sunny, one final question.
Yeah,
How do you actually feel about
Actually, I have mixed feelings about this. In the beginning, I was quite, at the start of the mask mandate, though, I was quite confused about what we should be wearing the mask. But now, 3 years later, I'm actually thinking maybe we should be a bit more cautious.
Same here, same here. And maybe we should get our vaccination rates now higher as we have gotten this ease in masks.
Right, of course. I'm sure Professor Kim will agree as well. All right, so as always, thank you very much for your time. And Professor Kim, again, thank you very much for your insights today.
Thank you very much.
Right, on that note, we end this edition of Issues and Insiders. Thank you for watching. See you same time tomorrow. That is Wednesday.